Hi, it's Jen Gilbert, and now that the long fight is over, healthcare reform is basically the law of the land. The question now stands, how is this reform going to actually affect you and the bottom line profitability of your medical practice? Now, of course, the bit of good news is that the legislation does mandate that Medicaid reimbursements must go up to match those of Medicare in years 2013 and 2014. That's exactly when you're going to start seeing approximately 16 million new patients with Medicare insurance starting to knock on your medical doors. However, as we both know, even with this increase, Medicare still will only pay about 60 to 70% of the actual cost of treating those same patients. In addition, I doubt that really most of us believe that the private medical insurance companies are going to be, shall we say, content with all of the new subscribers that they will have underneath these reforms. Now that they're not going to be able to deny those with pre-existing conditions, health insurers are probably going to be looking for, let's say, alternative ways to squeeze every possible penny of profit out of every single new patient. Those alternative ways may very well affect your bottom line in profits. Now, considering that your practice is likely to grow and increase by about 10 to 20% under this reform, your income is likely to stay about the same. It doesn't really bode well for a lot of great financial news for you and your medical practice. So, what can you do to start protecting yourself right now from some of the potential fallout from this healthcare reform? Probably one of the most important things that you need to start to consider is to decide to take personal control of your own finances. Now, we know from the recent recession that we just cannot trust the financial service companies to put our best, your best interests first. This means that you've got to start taking care of yourself and your own wealth if you're going to have the kind of future, the kind of retirement that you were looking for, planning for, and quite honestly deserve. Fortunately, there are wealth management systems out there that make it comparatively easy for you to safeguard for that future. And that's why I'm a former medical sales rep. Whatever you do, do not wait for the healthcare reform to have a negative impact on your bottom line before you start to take control of your wealth. Start learning what you need to do today so that you too can be prepared for tomorrow and your future. Now, I invite you to visit me, learn more at my blog. The information is right below, and I look forward to seeing you soon. Take care.